Okay, welcome everyone. This is our Big Data webinar series for the third quarter of CTSC. Today's webinar is about TriNetX database for intermediate use. I am joined today. I'm Ashley Hughes. I have a pending appointment as associate professor with tenure at Metro Health in the Center for Clinical Informatics Research and Education. I'm joined by Craig Jarrett, and we've had the pleasure of doing some of these webinars on big data to introduce Cosmos and TriNetX for population health researchers such as yourselves. So I want to give you a brief overview of what we'll be talking about today. We have some big data events on the horizon, including some future webinars. We'll begin with a brief refresher on the TriNetX database. We'll also be sharing the link. Each of these webinars are recorded, so you can go back and view at a later date. But we'll provide a refresher on some key terminology. We'll be focusing most of today's session on performing a live demo with some screenshots as backup, just in case our large data set doesn't want to cooperate with us today. But we'll be going into how to perform more complex queries within TriNetX and begin looking more at their analytics capabilities, as well as ways that TriNetX can help you visualize the data. We'll talk a little bit then about exporting data, figures, and tables, and of course, leave some time at the end for your questions. However, if you do have a question along the way, please drop it in the chat. You can also interrupt us along the way by raising your hand. So our first big announcement on future big data events is we will be hosting the second multi-institutional, so all of the institutions affiliated with the CTSC, the second annual, fingers crossed, Epic Cosmos Datathon. So this datathon will be taking place on October 18th. We'll be in the Midtown Collaboration Center. If you have an interest in getting together with other people to do multidisciplinary research, have an interest in using Cosmos, this would be a great event for you to attend. We do have some prior webinars as well, talking more about how to use and gain access to Cosmos. So you should be seeing more in your inbox soon. But for now, save the date for this upcoming event. We'll be holding a TriNetX Database Advanced 1 webinar in December, so in the fourth quarter of the CTSC. We'll be talking more about comparing outcomes between cohorts, looking at survival analysis, and other ways that you can go about requesting custom data sets from TriNetX. And then stay tuned. In 2026, we'll be coming back with some additional big data webinars. So to give you a brief refresher on what we talked about in the beginning of TriNetX, first of all, TriNetX merges lots of different types of data for millions of patients. And you can then actually do queries across millions of different types of data for different people. And the first step for anything related to TriNetX is, first of all, you need to get access and log in. I've got the link here, and I can actually, I'm going to ask Laura if Laura can drop that in the chat for anyone interested. If you want to go back and refresh your memory on everything we discussed in the last webinar. But you'll first need to get access and get in. For anything that you do within TriNetX, you have to start and create a project or my study. And then we also had covered performing simple queries. So in order to get access to TriNetX, just displaying this information here for you if you don't already have access. Metro Health, if you're a Metro Health employee, you actually place it via IAM request. If you're not affiliated with Metro Health, then you would first need to establish an affiliation with Metro, and you would do that by contacting Dr. David Kalber or Dr. Yasser Terabici. And then university hospitals, we have a red cap link here. There's some online training. I will say TriNetX, while we are giving you a boiled down version of how to do some very common queries in TriNetX, they do have a host of resources available on their website for additional training. So soon we'll be switching back over to Dr. Craig Jarrett, who's going to give us a live demo on using TriNetX. Whenever you need to log in, there's the sign in option. For each of these webinars, we really try to give a research question, an example research question that you can use and follow along with as an example. Our prior question was asking about the prevalence of hypertension in adults by race in the US from July 2017 through June 2024, so that we can do some more exploratory analytics with TriNetX today. We will be actually changing that research question to what was the percentage of adults by race in the US with essential hypertension that were prescribed an antihypertensive medication. So in order to do this, we're going to need to define our cohort. We'll need to log in. We'll need to better specify our cohort, and Craig will show us a little bit more on exactly how we'll be doing that. And that includes use of groups, which is just another way that you can further specify people who are in your cohort of interest. Craig, are you in a good position to start screen sharing?
Yeah, I can screen share. Do you want to run the query or you want me to?
Oh, I thought you had it queued up, but I have
Sorry, 12:23.
wanting to
So I
share.
can do it here.
Okay, sure thing.
When does the charge me? It might be my old HSA.
Laura, I am in the waiting room. Can you let me in, please, on another device?
Do you have to refund it to me today? Do you have to refund it to me today?
You can.
Okay, I tried with another device. I should be good now.
Okay.
So we'll share.
Thank you so much. Bye-bye. You too.
So it's very straightforward to log in. You sign in, and it takes you to another basically portal. And there we go. And so the landing page takes you to where you left off. So you may end up here if you've used TriNetX before and you've logged in, you may actually end up somewhere else. Ashley, do you have any more?
No, not really. I mean,
Okay.
yeah, so before,
You
if
went
you
very
have
fast.
yeah, it flew, time
Okay.
flew. But yeah, no, so you'll see here on Craig's screen that you have the option to create a new study, which may be, if you're using for the first time, you can go back and see in the beginner webinar, we show how to do that. But we have this query set up in the Big Data Webinar Intermediate. It's an open study. Once you've created studies, whether they're shared with you or your active studies, they'll appear on your landing page. And just as a reminder too, you can always go back and add people to your studies once you've already created them. So if you want
Okay,
to
so
Data Webinar Intermediate.
we'll jump in and I will make some room here. What we'll do is we'll duplicate this. So I have everything has been run just in case we get into a hiccup with it running slowly. This will, for people who were on the Cosmos webinars, TriNetX runs faster for most queries, a little bit faster than TriNetX runs a little bit faster than Cosmos. If you're in Cosmos and you use that sample cohort of 1%, then it's about the same. But anyway, so this is, I'll take you to my studies. The create study is here. And Ashley, did you want to walk through this?
Yeah, I feel we covered that in the beginning webinar, but it has an asterisk next to the mandatory items that you need to complete. And you can always reopen your study specifics once you've created your project or your study to either add someone or modify your primary therapeutic area. But they just basically use that for tracking purposes. There's no sort of approval process or anything needed from that perspective.
Right. So
Um,
I'll jump in and
yeah,
if I was creating a study, and so we'll just do this kind of, I'm going to do this as a two. We're going to conduct secondary research, and then the only other one that you have to add is here, the therapeutic area. And we're going to go with the cardiovascular diseases. So it's really all we need. And so now this takes you to the beginning of the query, so the query builder. It may be kind of confusing what to call this unless you're actually kind of a little bit deeper into the study. But we have a research question, and I can flip back, Ashley, if you want to show the research question.
yeah, I can do that. So I can also drop this into the chat as a reminder, but we updated our research question. Usually we would ask what's the prevalence of hypertension in adults by race in the US from July 2017 through June 2024 by year and quarter, to really what was the percentage of adults by race in the US with essential hypertension that were prescribed an antihypertensive medication. So for this particular purpose, that also means you notice in Craig's screen, it shows what, and actually, if you don't mind, Craig, I can actually show the screenshot of the query that you're building. When you're in this query builder, you have criteria of must have. So in this case, we're interested in people who have a diagnosis of hypertension. And as you can tell, we're not necessarily interested in gestational hypertension or preeclampsia that are commonly included with a general hypertension diagnosis from this more general ICD-10 grouper. Or at least I don't know if they use the term grouper exactly.
It's not, yeah. And
Yeah,
so grouper is really a
more of
Cosmos
a Cosmos term.
uh,
Yeah.
epic term. And so for TriNetX, it's really ICD codes. And so we are going to start with the Global Collaborative Network. That is the largest selection of patients. There are a couple of different ones. There are also some that are institution specific. So depending on how you get access to TriNetX, you'll have different options here. But we're going to start with the Global Collaborative Network. We're then going to apply some filters. And again, it's just a completely different layout, different graphic user interface than Cosmos. It's just something that you have to get used to. So the main thing that we want to do is we want to limit this to adults. So we're going to leave the medical centers as is. And you can play around, but it's academic, non-academic, or unknown. The important part there is look at Metro and look at UH. Cleveland Clinic doesn't donate or doesn't contribute data to TriNetX, but all those hospitals have both what would be considered non-academic practices. So if you look at some of the smaller suburbs, family health centers. And that really means, are you affiliated with a medical school? And so I'm not sure this is very useful for most queries that you determine academic, non-academic, because if you are UH or Cleveland Clinic or Metro, you're going to be considered academic, although part of your practices are out maybe perhaps in rural Ohio, right, that don't have residence fellows or any of those other things that are related to academic medicine. So we're going to leave that as is. The data available, they break it up into the standard kind of interests that you'd be looking at. So demographics, diagnoses, genomics, labs, medications, and procedures. And we'll see that again. We're going to leave all those. And the one that we're focused on here is we want to do just adults. And so it's pretty easy. You can just, we're going to cut it off here, and it shows kind of in real time what happens with those patients. And you get a general sense of the spread of the patients. I saw this and I was like, there's something kind of weird with the data going on here, that there's a very large group of 78-year-olds and then a much smaller group of 79, 80, 81, 82. The curve jumps around a little bit, but so anyway, we're going to keep that as is, save criteria. And then now you can see we're in the global collaborative network and we have adults, all adults. What we want to do now is we want to focus on what are our broad inclusion criteria. So for this webinar, we're only going to focus on single cohort studies. And so we can make comparisons within that cohort of course. And so we do want to look at hypertension, and we wanted to look at that by race. And so we'll do that here. And so there's this code, which is hypertensive diseases. These are ICD-10 codes. If you do have ICD-9 codes, they do roll up into ICD-10. So they've done that for you. You can look up how they mapped it. For most purposes, I think it's appropriate. But if you're publishing, you definitely want to see how they, and you're focused on, circa 2016, 2017 was kind of the change from 9 to 10.
Mhm.
Doing studies prior to that, you want to make sure that the mapping kind of is appropriate. And
And
so the hypertensive diseases here, we're going to include all.
And do you want to show, Craig, like within that criteria, the hypertensive, like how you can expand that, right? Because it shows you a preview that there's like 27 million instances of it, but you can do like the little flow diagram, or you can kind of see below, right? Like it says I-10 through, um,
So you can see all the different ones here. If you wanted to
yeah,
go here, it jumps into
right. You can then
pulls up to that.
Yeah, you can see how it rolls up to that, and you can actually toggle back and forth to see what falls under that ICD-10 category, that range that they include. And that can help you better specify the must-have versus the cannot-have. So that way you can still select some of the easier to find, hypertension diagnoses, and be able to have and refine your exclusion criteria as well. Thanks for that, Craig.
And so we're going to want to exclude, as we said in the research question, those patients who have gestational hypertension. So that's the ICD code of 013. And then we're also going to exclude patients who have preeclampsia, so hypertension related to pregnancy. And it gets, here we go, preeclampsia is 011. And so again, the ICD code 011 has many, many underlying codes, but if it starts with 011, so that could be 011.1, .2, .10, the way it's shown here is the most inclusive. And so we're going to exclude those patients. So our inclusion criteria currently, hypertension without gestational or preeclampsia. I've named my query. You can also, again, you can create super complex queries. I'm going to close this and make a little bit more room. The query I just created ends up being shown here. And so if you have a bunch of queries, you can kind of click to go into those very quickly. I'm gonna hide that just so there's a little bit more room, and then maybe expand. There we go. And so the first thing you have to do is you have to count your patients. And so this kind of sets up the underlying mechanisms by which you can do additional analyses. And so this usually runs pretty quickly. I'll let that work, and I'll jump over to the same query that it basically created, as you can see here, and just to keep progressing, and we'll go back to that and do it in real time. And so the healthcare organizations, some of the queries you can actually get additional data on, some you can't. For this particular one, it says cannot be run on queries created on this network. So this is remember the global collaborative network. If you pick a different network, you could get additional healthcare organization data. So here I've already run this. Let's flip back. So there we go. 013, 011. And so this is if you're just starting a query and you've created your query using the query builder, you have to do the run. And this is what it could take a couple minutes. And so I've already run this, of course, in the background, and this is what it looks like. And so they give you under explore cohort, you can explore your cohort. And so you can see that very similar plot of the ages, looking at different races. You can also then dig in a little bit deeper. I'm going to click through each one of these. They rank the diagnoses. So they basically will, the highest percent of your cohort, they'll put highest, and then they go down. So you can kind of explore. Again, this is just to get a sense of, are you looking at the patients you think you're looking at? You don't need, you could skip all this if you want, and it's not going to affect your later analysis. And so next is the procedures. And this again, it ranks them, I'm sorry, oncology, it ranks them kind of in this order: primary site histology. We're not focused on that, so I'm going to quickly kind of glance through that. And then here is the procedures, again, ranked by most common. If you know CPT codes like evaluation and management, well, that is basically every office visit is a evaluation and management procedure. The ones, of course, that we would think of as procedures are here, so surgery. And you can see kind of the breakdown, and these keep going down. You can absolutely go down a rabbit hole pretty quickly here. And then here, the medication, same thing. You can open these up. We're going to focus really on the antihypertensives. And I'll point it out here. This is a good thing. You know, some people would put a dash in as antiarrhythmics or antihypertensives, like anti-dash hypertensives. Just realize when you're typing, if you don't see what you think you should see, it just may be spelled a little bit differently. And it doesn't, the system isn't quite smart enough to catch that, strangely, but
Yeah. And just remember too, there are multiple ways to look for that, information. But yes.
all right. And next, the analyze criteria. This is primarily used, we're not going to do it today, but it's primarily used when you're looking at a clinical trial and you're looking if you have the necessary number of patients to enroll at a specific site. And so this can create funnel plots showing where you lose patients. If you, for instance, if you create a more defined inclusion or exclusion criteria, how is that going to result in your final population? It's really specific to clinical trial recruitment, so we're going to skip that. Very similar thing here, rate of arrival, that's very specific to clinical trial recruitment. What we want to look at is this, the summary statistics. And again, this is just, if you were in R, you would maybe do a head of your data set, or you can look at these are very high level analyses. And so here they go through the ones that they think you would appreciate. And so the length of patient record, this is good because, you can see here that about, out of the 26,000, there's a significant number. So, 15,000 or 15 million of those, I'm sorry, have been in TriNetX greater than 5 years. Here, the fact distribution, and they do even go down here and they do a geographic distribution of the patients that you can then click and, expand as you would with any kind of mapping system. And so that's nice. Still, it's not quite into the meat of the question, but you can start to see if you have enough patients. And this is a little bit different. It's similar to Cosmos in the sense if you get a data set that is less than 10, it won't let you kind of go any further. But it's you can definitely get down to much, much smaller levels. And so for now this is where you kind of actually start, after you do your query, where you start to do the more interesting work. And I'll go back here to show you what that looks like in real time. So if you're just starting your query, you have to hit the run. It's going to take some time, and it will do that summary statistics. Similar to that, you have to hit run for the analytics. And so I've already done this one. We're going to create a new one so that you can see the different options available. And so they try and guide you down a path
Nice haircut.
Thank you.
of what you should pick. Do you have single cohort or two cohorts? That's an easy one, to kind of determine. They even give you, a research question, right, that you could potentially answer using one of these analyses. And so pretty straightforward. We'll get into some of these today, and we're going to wait on some of these for later. They also tell you what is like in the works. And then if you have a specific analyses that you've asked them to develop, they would potentially be here. And so we're going to focus on the incidence and prevalence, because that's basically what our question is. So we're going to do the single cohort model. And then this is the query I built in the query builder. And so it's as simple as dragging and dropping. Of course, since it's only a single cohort query or analysis, you can only drop in one data set there. And so I'm going to back out of that because I don't want it to run again because I've already run it. That's this one we just created here. I'm going to delete it. Here's the one I already created, but you get to the same point. So this is it. Then you hit go to inputs. And this is where you start defining what you want to do. And so you can expand some of these. We've already put in, and it's coming from the actual query. So if you wanted to change that, you don't change it here, you change it in your actual query. So we have adults with hypertension, don't have gestational hypertension or preeclampsia. And so that is literally, it's just from the query builder. We wanted to specifically look over time, have the percentages of those diagnosed with hypertension, has the percent of those that are on a medication, have they changed over time? And you can think of, big pharma, is there a higher percentage of patients over the years on hypertensive medications? And again, that's an association, it's not a causality. But so we do have to set in time windows. If you didn't set in time windows here, it would just do an overall beginning and end. But here you can actually, this is where in Cosmos, the equivalent would be that one button you click and you can get it annually or quarterly or monthly. Here, it's a little more manual. You actually have to type these in individually. And so I'll show you what that looks like. You just hit add another time window and you actually just put it in. I did this obviously already to kind of get a head start, but put in the times and then you can put the label in. So the label is what's going to show up actually on the picture in the table. If you don't put a label, it will put this in, which it of course is a lot to fit in the picture. You can do a look back period. And so what this means is if you wanted to look at an analysis from a specific time point, so this is 1 day before the start of each time window. So that's as it says, but you can say, look back a year. If we're just looking at incidence and or prevalence of being on or having hypertension and being on a medication, we don't necessarily need this. So we didn't put anything here. And then select strata. And so this is the equivalent in Cosmos of would be like a slice. And in TriNetX, they only allow you to do these 4. If you have a more specific, like let's say you wanted to slice it on 6 or 7 different things, well, then you should probably be choosing another analysis. And we will show you that in a future episode. And so we did have an interest of looking across races if there was a difference in the percent of the people who have hypertension if they're on a medication. So of course we select that as the strata. And then the event of interest. And so this is your, our question was, are they on an antihypertensive? And it's as simple as typing it in. This is where, if you put in anti, it may or may not get it. So no matching terms, as I had mentioned before. So just get rid of the dash and it will come up there. And so I've already done that. There are about 9 million people who are on antihypertensives again, and that is in each individual time period and with a diagnosis of hypertension. And so we can run that. I've already run it. Oh, it says I haven't. We'll run it. It shouldn't. And so you guys will get a sense here in real time of how long it takes. Flip back to the other one. When you start playing around with it, if you change too much or manipulate your analysis too much, it will show, as we saw, that you need to rerun the analysis. I technically didn't change anything, but it's not going to show that. So we'll let this run. Actually, if you want to pull up the slides, it's running it. I have to say this is usually it jumps up to 90, 95 pretty quickly. If you want to get the slides ready, we can go. We have screenshots for this exact purpose.
Yep, I'm just getting over to the, here we go.
And if you don't mind clicking forward to the section we were in.
Get it in presentation mode. It'll take just a second. It should take just a second.
Still not showing, Ashley. I don't know if you.
Yeah, it's
There we go.
okay.
All right. Yeah, so after you run the analysis, this is what shows up. And so they've kind of done this for you. They show the incidence, prevalence, and incidence rate over those time periods. So that's kind of getting to our question. And I'll keep an eye on the actual query on my end. And so this is just the bottom half of that page. If you scroll down, and again, hopefully I can show you that in real time. But this is where we broke up the incidence and prevalence based on race. And so they've defined these races for us. And so you get these kind of very simple, straightforward plots. As you can see, I did this, and it's sometimes you have to shrink your screen or make your screen bigger or scroll your screen laterally. It's not as reactive as far as the size of your window, but it's definitely usable. And so if you go ahead, Ashley, were you going to show something?
No, I was just going to use laser pointer to
Okay.
point out the different pieces, what you were talking about. So it generates, they're not the best quality of figures, but most of the analyses that you run in TriNetX will come with some sort of supporting figure and table to go with it. You
And
want to go to the next?
I just look back, the query is still at 50%. So I'm glad we have screenshots.
Yeah, me too.
A webinar at noon during the week. This is kind of what we're asking for. So I will point out here, the important part is the pictures that you see on the right. We're going to show you exporting these, and it exports them just as you see them. unfortunately, there's no legend. And so when it's exported, and so the colors that you see of the lines are the colors of the dots next to the race over on the left. And so you kind of, again, as Ashley said, it's not really presentation or manuscript quality, but it does allow you to kind of quickly look and have a lab meeting, and you can do this within a matter of minutes as long as your query runs quickly. So go ahead, next slide, please. All right, and so we'll get to the exporting the data, images, and document. So yep, it's very simple. You can hit the export button, and there's three options. You can export the data, and I've done this, and I'm happy to show it. You can export the data, you can export the images, and you can export the document. And so I will pull those up and show you exactly what they look like. They're again, this is you think like, hey, I just click this button and I get, these exported documents. It's for that purpose, it's pretty nice because it's kind of a freebie. It's just as you can see here, and it looks like it's going to be all you need. It's not, it's just not quite. And so if you look at the query we did, super simple query, like just it's not a complex query by any means, but they give you this nice Word document that you can share with other researchers. And so it goes through all the details, kind of what we put in, all the screens we've shown, they consolidated here, the time windows, look back periods, strata, and it's all kind of nicely shown here in this Word document. They put it, of course, in tables. Here's what I was talking about before. So you get these pictures. Again, no legend, so you don't really know what race is which. Not quite presentation quality, but really nice for kind of a lab meeting to get it in quickly in real time. And so that is the Word document. The other options for exporting are the images. And as you would expect, they kind of show up just as they would in the Word document. This is the stratified by race with no legend for race. And so you can do document, images, or the actual data. And so let me show you the data. And this is what I do when I work in TriNetX. You take it, you can import from this row on, and you have your data. You don't have to copy paste, you don't have to retype. And so that's really nice. And then you have all the different tables that came up with that data. And so then you can create your own graphs and go from there. All right, I'm going to stop sharing. You can go back to the presentation if you don't mind. I'll take a look at the query, and it's finally done.
Oh, great. Did you want to is there anything from the live query you wanted to share?
I think, I mean, I'll pull it back up, but it's
Yeah, go ahead and because
that way if there's questions related to it. So
yeah.
here is again the same analysis. It ran again, same pictures. This is what I was talking about. Like currently I'm on a laptop. When I created the screenshots, I was on a large monitor, right? It's the TriNetX platform is it's good. It's not great. And so here you do have to kind of manipulate. And so if you look at my Zoom, I'm at 100% and you still can't see the pictures. And so you may be like, well, where'd these pictures go? And so again, play around with your screen setting. You'll find one that works for you. And then once you find it, that'll be the one to keep. But same pictures we saw before. This is the export in real time. It exports very quickly. So there we go. And then the other things that we just wanted to quickly show, those same tabs that were there before, they've collapsed them. But you can get back to them by going to kind of any of these. So if you go here, for instance, they kind of open back up and you can see where you are. So we've went through all of them to here. We're going to get into pending and available data sets later on. Just as an overview, the connect is if you have a clinical trial and you want to connect with other centers. Study management is where you go back to kind of make changes to that initial document that we made. And so, and then this is also where under study management you can share. And so it says, we're sorry. Get a lot of those. We're sorry, connection. But this is where you would share. We're sorry, there was a problem on our end.
Mm.
This is where you would, for instance, share with your study team. Okay, I think.
I'm having to log back in. I got kicked
Yeah.
out. I can
Did
end
all, maybe
show.
everyone just logged in?
Yeah, that must be it.
But you can go back to the slides. Ashley, I think
Yeah, we're
the query is again TriNetX as with Cosmos. There we go.
I don't think we necessarily
Okay, I
or anything about this, but just know that you can, as Craig showed, you can go back and look at these other, let me see if I can just show on
and
one.
here's the I found it reconnected for
Did
me.
it do
So
it?
if you want to share your current study, you just go down here to Teams, share study, and of course I've created and shared this one with Ashley. So you just share a study. You can literally search. So it doesn't have to be at your institution. It can be anywhere, which is nice. But they will be able to find them if they have an account. And then you can also drag and drop documents if you have you want to collaborate and you want something on their portal. And then lastly, there's this design assistance. If you're really struggling, you can ask TriNetX for help. They say they get back to you. I've actually never tried this, but they say they get back to you within a couple of business days. The last thing I wanted to show is, and we showed it briefly in the intermediate, but if you have any questions, there's a ton of training available. So the training center is phenomenal. They have a TriNetX 100, 101, 102, as you would just like a college course, increasing level of complexity, and they do some very, very deep dives into like for instance maternal fetal medicine, things that aren't necessarily intuitive, and so you can probably find that in the Q&A or on the training program.
Right. They are very good at giving you links as well, not just to their trainings, which some are offered live. You can always get the recordings of them, but usually they include some sort of document, transcript, or supporting documentation that sort of goes over what they discussed. So even if you can't attend one of their live meetings, trainings, you can always catch a recording like what we do with CTSC. So just showing, oh no, it's still showing my PowerPoint. I was hoping to show you just what it looks like when someone shares the study with you. But it just shows up under your studies in a slightly different way on your landing page. So just to move forward here, where we are, we went over how to export. Just as a reminder, we're coming up, we're a little bit early, but we're coming up on time for Q&A on TriNetX Intermediate. Just remember that if you have an interest in Cosmos or using big data, even if you're not a Cosmos user, encourage you to at least consider attending our second annual Cosmos Datathon in partnership with the Epic Corporation, and that will be taking place Saturday, October 18th. It's kind of an all-day event, but last time we had a lot of fun, and it'd be great to have you all join. Our next big data webinar, as you saw from the preview on Craig's screen, there are several, unlike Cosmos, there are several different ways you can define, manipulate, work with a cohort in TriNetX, what kinds of data networks you're working with. You can also play around with different analytic tools. So next time we'll be talking more about how to set up your query in a way so that you're creating two cohorts, that you're able to do some some analyses that involve comparisons between more than one cohort. We'll also get into, some people like to look at differences between cohorts, not just on outcomes, but also on characteristics. And because this also includes claims data, you can also get into some survival analysis in it as well. There are also, even though Craig showed us how to download the data and different ways that you can do exports from TriNetX, there are also different ways that you can go about requesting data sets within TriNetX, including requesting a data set curated for your research needs. And then just stay tuned when it comes to 2026. We'll still be doing big data webinars, so just stay tuned on that front. So at this point, we'd like to open it up to you all for any questions you may have, thoughts that you have on using TriNetX.
And as everyone saw, it is it is a bit challenging to do a webinar in real time with these large data sets. So thank you for your flexibility, and but it runs relatively quickly. So minute 2, sometimes 3. It's too long to kind of have that pause on a webinar, but it's to actually work with. It's quick enough. It's plenty fast enough.
Mm-hmm. I echo what Craig's saying. It really, most of the time, it doesn't take as long as it was taking. It's very infrequent that you have those, delays. Is this Dr. Singh?
Yeah, hello. Hi. Um, I had a quick question. Whenever we are running the query like for the first time, um, so I was trying of thinking like an example of I was trying to like make a query for like someone who is using benzodiazepines and had like falls in future. When we do the first query, I was trying to understand what's the temporality like. Is it like if they ever had in their chart, like even in childhood, any benzodiazepine, or how are like when we do the first step and we run the count, how are those two queries, like if we do like and or, how are they like related? I didn't get that part.
So just to clarify, Dr. Singh, you are asking, your first question was about the time period, correct? On
Yeah,
the
when we were
benzos?
doing the first query run.
Yes, so the time period, you can specify the age of the patients that you want to query.
Right.
I'm gonna stop sharing, and Craig, either you can share or I'm just bringing up my TriNetX screen so we can show that. Um, there are different ways to work with time when it comes to TriNetX, and it really comes down to your research question. Are you only interested in adult patients or people who are above, a certain age criteria, like 65 and up? Or are you more interested in the date in which something happened, right? When they were prescribed the benzos, not how old they are in the data set. So I guess that would be my first sort of clarifying question, because you would go about it in a different way. Like if you're looking at like age at diagnosis or age at the time they were prescribed something, that's slightly different than specifying um, who you want to query. So I'm just going to share real quickly here that the way that there are filters at the top, right? Again, as Craig mentioned, this is the Global Collaborative Network, which is kind of just looking across everyone who contributes to TriNetX. And if you wanted to, like, let's say that anyone who was prescribed a benzo, but they needed to be an adult or they needed to be a certain age, like you would come here under population. When you pull up the filters, these query filters appear at the right-hand side, and you would specify in here, okay, do you care if they have an unknown gender or that kind of thing? So, or unknown sex. And then, because we were interested in adults, we put 18 here. So does that answer your question, Dr. Singh, or was it was your query more nuanced than that?
Uh, I understand, like when I run the analysis and outcomes, I can like define temporality like how they were like related in time. But when we run the query, I think it takes in like all the time frames.
Yes, so it usually will default to you've had someone who's had this event or this diagnosis or this prescription at any point in time.
Okay.
So that, but that's default. Now you can finesse that, but usually that's more, at least how I've done it, is really within, I mean, you would still have it within your query, right? You would have whatever, I'm just going to use hypertension because we have that here. Um,
Okay.
kind of under analytics, how I've done this is I've defined it as an index event. And so my index event, if I'm interested in like just exploring, I don't know, just if I want to specify, if I wanted to say that I'm exploring something before or after, which may not necessarily be what you're trying to specify, but you can specify, okay, I want to look at patients before and after they got a benzo prescription. That's one way to look at things within time. But if you're also trying to like define your cohort based off of like, because you're also talking about the first instance, right, of getting a prescription.
Yeah, yeah. But
So
I
those,
think you answered my question. Uh, I had one more question. I can go later if there are others waiting, but uh, can I go now?
Actually, I think you cut out.
Yeah, my question was simple. Like when
oh,
I just like a random, like a patients with schizophrenia who have
mhm.
KRAS positive. I was lots of very few patients have like genomics on TriNetX, and I'm trying to just find out, maybe like build a research question, like where are these people, like what happened to them. How, I think that the way of doing it is like exploring cohort and then going to diagnosis, or uh,
I mean,
You,
you
yeah.
said you want genomic. You basically only want to study patients who have genomic data.
yeah, and then figure out like what was their cause of mortality. How can I find that?
So you can definitely look and determine if a patient has genomic data specifically. I mean, we briefly showed, and I can go back to it, but we briefly showed the when you analyze your criteria, there's that. I'm sorry, when you explore your cohort, there's that genomics tab, and
Yeah,
there's hundreds of different tests, and
yeah,
so you could, I mean, that's a little bit of um, maybe it's better to come up with a research question first rather than look for significant, events in the data. But you have a subset of genes that you think are related to schizophrenia.
mhm,
And then you can definitely pick, and you can only analyze those patients who have those, that genomic data in TriNetX. So you're already picking, you're cherry picking patients who have the genomic data, but there's nothing saying, and we're planning to do this for the advanced or advanced two, you can propensity match those patients. And so you can look for patients in TriNetX with the same criteria that don't have the genomic data. And that would be one way to kind of determine if that would be a secondary question, like, is the subset of patients in TriNetX that I'm looking at with genomic data, are they for some reason different than the patients who don't have genomic data, right? And so that would be like a
Yeah.
secondary question. You could look at the plots for the propensity matching and determine how close these cohorts are, because inevitably somebody's going to ask that. Well, they'd say you're you're starting from a subset of patients that may not be like other schizophrenic patients.
right.
And so there's
Um,
that genomics tab. You can absolutely pick, like, you want a patient to have this test, and that would just go into your query builder must-have criteria.
Yeah.
my question is like, I don't know if it's not the ideal way to look at it, but I was trying to frame a research question, like what outcomes should I be looking at? Can I use TriNetX in that way? just something which stands out.
I mean,
Do you have a specific outcome in like that you're interested in?
I'm not like I'm trying to find an outcome I should be interested in. Is there a
So-
way like I can look at the data, like what was like their cause of mortality? Where are these people now? Kind of.
So, I mean, you can always explore, you can always, so I mean, I ran this, hopefully you guys can still see my screen and that it's showing TriNetX, but, you know, as we were mentioning, you know, you can always look at the genomics, you can look at the diagnoses. One thing that you can do that we were kind of talking about possibly doing today is, you know, how do patients analyze outcomes of a single cohort of how do patients in a cohort experience outcomes?
Right.
And so you could explore within that. However, it's always a tale of caution when it comes to using these large data sets. Um, I take it you're a clinician, and so you can use clinical reasoning to try to make sense of some of the things that pop up within TriNetX, but within any sort of estimated population level data set, you're you just want to be really cautious about going on a, you know, like a statistical,
Hmm.
for lack of a better word or term, fishing expedition. You just, you would, it's really more ideal to be driven by what the literature is saying on, you know, how schizophrenics are, you know, experiencing disparities or, you know, whatever the story or narrative might be. You would really, just because that's going to help you so much in making sense of the data
Mhm.
that you get out because it's, you know, even just in working with medical students on their use of TriNetX, it's really easy to get significant differences between cohorts. It's much harder to interpret what those mean
Hmm.
because you really want to have a meaningful takeaway to be able to say this difference tells us something about people experiencing hypertension and how they're experiencing their care differently or how they're getting missed for prescriptions that they should be getting. Whatever that narrative is, whatever that story is, that what's guiding your question will also help guide your interpretation. So I don't know if you joined the, and I can drop this link in the chat, but Dr. Kalber had published a study on, well, not exactly a study, but a guide on just
Big data, big responsibility.
yes, with big
Yeah.
data comes big
Yeah.
responsibility. Yeah,
I was looking
absolutely.
at it. Yeah. I like that. Yeah.
It's a good article. And I just, you know, I think that gets recommended just because again, you know, if you want to find something of significance, you will find it in TriNetX. It just, it does not, it will point, it's literally looking at the numbers. It doesn't have the clinical reasoning. It doesn't have the researcher time, you know, frame to help you make sense of what that result means.
Okay. Yeah. Well, thank you.
Okay, thank you. Thank you all for attending today. We will be hosting office hours. So if we didn't get to your question, we'll have office hours same time next week from 12 to 1 on Wednesday. Thank you all.
I would be like to be added to that. I got this link for this meeting from one of my colleagues who works on TriNetX. Is there a way I can like sign up for these?
Yeah, if you're not already a member of CTSC, I have to get going for another meeting, but Laura, are you able to? Oh, Laura has to drop off.
Okay, I'll,
I'm
I'll
just
just
gonna drop my email in the chat. Just send me an email and I'll connect you with Laura and make sure that you get added because we are trying to establish a listserv of people who use these products and services and make sure that they're, you know, we're really engaging with people who um, care about, you know,
Yeah.
using these for research. Okay, all right. Thank you so much.
Thank you.